Hi there, I'm Dr. Steve Mary, the chair of the Mayo International Health Program, and I'm really glad today to have with me Dr. Shah, who is the Vice Chancellor of Patan Hospital's Patan Academy of Health Sciences in Kathmandu, Nepal. He's a general surgeon and professor of surgery there. Dr. Shah is here with me today to speak about Patan Hospital and tell you a little bit about why doing an international rotation as an MIHP scholar at Patan Hospital is a really good idea. So tell me, what is it like for an American resident or fellow or a health science student, medical student, to come to Patan Hospital to study under your tutelage and that of the other professors there?
Well, I think this is basically let them have a chance to see out of the box probably what you have over here. How do we take care of our patients over there, even if we are much less resources over there? Most of the American students are used to have everything. You have no sort of resources over here,
right?
And you take it for granted that whatever you demand is there, and still there's lots of discrepancies in the care you give over here.
Yeah.
For example, the care given in Mayo is best care in the world, yes. But again, the same student, if they leave Mayo Clinic and they go to the other suburbs in America, they will be seeing a different world probably. So that's the things they will be seeing over there. So how you can deliver best care in given resources.
And that's what we were talking about yesterday, how the residents who come back from these rotations, wherever they're doing them, almost uniformly say, I learned that I can do a good job taking care of patients in a resource-limited setting, providing good care.
Yes.
So that with your 500-bed hospital there, doing some 30,000 surgeries per year, volumes like we're seeing here, taking care of 300,000 outpatient visits per year, numbers again like we're seeing here, delivering 9,000 babies at Patan Hospital per year, which is 4+ times what we do at Mayo Clinic Rochester. Residents can have a fabulous experience seeing care well done at very, very low cost.
The aim of this global health, or you say international rotations or selectives, they just get different perspective of doing things over there.
Compassion needs to extend beyond who comes here to those that can't even access care. Great for our residents to see that, to learn that. And what we find is then they end up in rural areas in the U.S. Because that compassion, then they learn they can extend that to care of the poor with resource-limited settings.
And hopefully, probably, your residents here, after this exposure outside world, they might be motivated as well to provide care to the rural guys, folks in the America itself. All around the world, you have poor people, you have rich people. And same thing is true in probably America. And probably in America, you have more difference than what we have over there.
Huge disparity.
So again, that's the same thing. They have to feel that way, that medicine is all about caring for the society.
Tell me about what it's like to study under your staff there at Patan Hospital. What kind of experience could the resident or fellow who's coming expect in terms of educational benefit?
We have a system of there, like having residents for last almost over 20 years. So we do have a staff, we do have the facilities, we do have the system to take care of them. And right now, the residents who are offering is general surgery, medicine, gynae, obs, peds, and family medicine. So these 5 are already running for the last 20 years. The next we can extend is probably the ENT we can extend, orthopedic we can extend, psychiatric we can extend. So these are the
all those specialties would fit well
so
for
these
rotations
are and on top of that, they go in the district rotation, posting for 6 months. And we have 4 district hospitals. 2 are in mountains and 2 are in plain. And that will probably have a experience for the residents or medical students even, if they want to go over there. They have to go out in the districts, and that will be really eye-opening. You have to walk for maybe sometimes 3 to 4 hours to get to the hospitals, and it's a real different world probably.
So it combines trekking plus
seeing that place, rural health, and it's a real rural health.
That's great. So I'd like to hear from you, what does the ideal resident or fellow or medical student coming to Patan Hospital for a rotation, what do they look like? Tell me about their character and what you find is the best learner.
The best thing we look into in any student is their attitude. That's what counts in the long run. It doesn't matter how much knowledge you have, if you're not well behaved, not well attitude, that doesn't work. The good attitude that I want to go and learn there.
Humility.
Not to teach there probably. So learn there from different perspective, different environment, and you will definitely learn something over there that you can't learn in America, you can't learn in Mayo Clinic.
Do you have one final thing you'd like to tell a prospective learner as they prepare for a rotation at Patan Hospital?
That they can contribute to the society at Patan itself, to the Nepali society itself, and they can learn better from us. And when they come back, they can do the same thing over people or the society in America as well. Both of us will benefit.
Thank you again for being here this weekend.
Thank you.
We really appreciate your presence here, the chance for us to meet somebody from one of our Mayo International Health Program designated sites and have you teach us about Nepal and the medical needs there, as well as what Patan Hospital is doing to meet the needs of the poor.